Similar to root cause analysis is the Plan, Do, Study, Act module. This is also known as the Pdsa. The Pdsa is used in order to create conversation about a particular issue and then develop a plan to resolve that issue, as well as measure the outcomes which occur after making a change on a certain unit or in a facility. During the planning stage, the nurses or the group of nurses, doctors, physical therapists, anybody who is experiencing this problem in a particular facility or unit will brainstorm questions which might be useful for creating a plan to resolve falls. This serves to help decide what specific goals we have for fall prevention. Questions might look like who will benefit from fall prevention? What age range will we target for this initiative? Why do we want to prevent falls? What challenges do we currently face when trying to prevent falls? In what way will we prevent falls? After the group has decided how they will prevent falls and they are done with the planning stage, they will move on to the do phase. During the do phase, the group has to make sure that they are clear about what change they will make and how they will make that change. In this do, we will look at the change of providing more training on how to ambulate patients during the post-operative period, which would be provided to any caregivers at the bedside. This might include nurses, certified nurse assistants, or licensed vocational nurses, in addition to any physical therapists who wish to attend the training program. During the next stage would be the study phase, where the group will review what results are present in their data. The group will have to decide if the plan was implemented well and what changes they would make if they wanted to repeat the test. The group would also want to study if fall rates did reduce with this change that was made, or if the rates of falls did not reduce. In this case, the group decided that the training was useful and that when they measured it over the course of 2 months after the training had been provided, that the rates of falls did reduce by about 10%. They also noted that this prompted the nurses to communicate more frequently with surgeons, nurse managers, and physical therapists on the topic of ambulation. Last, the group will act. This means that if the change was effective, the group will establish a new protocol for this new change to become the standard of care. If the change was not effective, then the group may wish to discuss how they might fine-tune their change in order to get the results that they are looking for. In this case, the group will continue with the Pdsa model until they achieve their desired results. In this case scenario, the change was effective, and so the group decided to communicate their findings with other units in the hospital who are also experiencing a high rate of falls.